Hi everyone. This week's case study is a pretty interesting one. First, we're going to show you a before picture, and really we focus more on what the hip, knee, and actually feet were doing. So the first set of pictures, you're going to see this person with his foot toed out considerably. You're going to see a wider base of support, and there's reasons for that, which we're going to get into when we go over the when we go into the level 2 certification. He had a rotated pelvis left to right. So the foot position on the right side would actually be a compensation for that rotation, as you know. He also had the shoulder blade, which you're not going to see in the picture, but it's worth mentioning because this is going to go into the level 3. And his left shoulder blade was more abducted than the right, and he had a forward head position. He had a little bit of kyphosis as well, but not all that bad. So with the after picture, I think the biggest thing that you're going to notice is you're going to notice a closer foot stance. In other words, the base of support is more narrow compared to the first picture. And then you're going to also see with the left hip, you're going to see less external rotation. So remember, you're looking at the femur bone in the position of the knee. It's less turned out in the after picture than the before picture. So as regards to symptoms, he actually had quite a few symptoms. And primary was he had a left hip, almost like an impingement. He couldn't even go into hip flexion because he kept getting pain in his left hip. He had bilateral medial ankle pain. Right shoulder, he had an AC separation years ago, and his upper back on the left mid-scap region was he was having some pain there. So what we did, the after pictures are actually pictures that we took weeks after, but I just want to show you before and after. Again, this is tying into the level 2 certification. And primarily, we went after the rotation, of course. We went after the rotation within the hips, but then we also went after a lot of T-spine extension. And that, and again, I'm jumping ahead a little bit because this is more in level 3, but that T-spine extension was really critical in helping hold his pelvis in place once we took that rotation out. So I'm not going to go into too much detail on that, but I do want to go over the corrective, what we did with him. The first session, we actually attacked his upper back. We went after the presses, then we went into that twist back, that reverse block that we do. Then we went into that big lat stretch. Now that's the one we come across, which you've seen on some of the other videos. And then we went into a hip flexor stretch. Then we went into the legs up the wall with a split. And then we went into the ankle squeezes prone, and then we went into ankle squeezes, but he was kneeling upright. And as you know, the sequencing is absolutely critical. So after we took him through that program, pretty much the rotation was gone, which was absolutely key. Right foot wasn't turned out as much. And so he's progressed with these routines. Really, it's been a couple months. And currently, his left hip, episodically, it's maybe a 1. He said he barely feels it. He could go through all motions. He's exercising. He's doing the things he wants to do again. And really, he's asymptomatic right now for the most part. So check out the exercises that we took him through and look at the before and after pictures. And again, the key things you want to note is the narrow stance, and then look at the rotation of his left hip compared to his right hip. So stay tuned for next week's case study, and make sure if you have questions, you're posting them on the conversation board. All right, we'll see you soon.